What is GBS? Group B Streptococcus. This is a bacteria which is found in the vagina, and some countries would screen for it in the vagina, like from 36 weeks or 35 weeks onward, to see if you have this bacteria in the vagina. This is done because if you have it, then there is a small chance that when the baby is coming out, the baby can have this bacteria, and the baby can get a small chance, around 1 to 2% risk of having a GBS meningitis, which is a brain infection. So to prevent this, there is treatment in the form of IV penicillin every 4 hours when you come in labor. As in, when you're leaking or when the baby is coming out, we will be giving you this IV antibiotic until you deliver. Now, some countries don't do this. Like the British people don't do it. In India also, some will do, some won't do. In UAE also, some people are screening for it, some people are not. Now, it doesn't matter as long as you come in labor and you deliver. Suppose you had not screened for this infection and you come in labor and you take a long time to deliver, you will anyway need antibiotics. And most of the time we have our set of antibiotics depending on most commonly found bacteria in vagina. But if you have not done this test, or your doctor has not offered you that test, you don't need to go and ask for it, because your doctor is going to give the treatment and labor and delivery experience for you depending on her skill set. Every doctor is different from a different country, especially in UAE. So you will see different people, but they all are trained to keep you and your baby safe. So just because one doctor has done this particular test and the other has not done, doesn't mean anything. It depends on where you're going to deliver. So sometimes I see patients, in our hospital, we will do this test because that's our hospital policy. To do this test, our pediatricians want this swab to be checked, all of that. But some doctors, they don't do it because it's not in their training and they don't think it's relevant, because their pediatricians would still look for it and start the antibiotic if there are signs of infection in the baby. So they think it's not relevant, but some countries do. And they have a whole set of treatment depending on this infection. Now, I have had patients who have asked me, okay, it's not there now. Like, they get so worried when we do that test. First of all, no one wants to be touched down there. Understandably, I don't want to force you, but it's an optional test. If you don't want to do it, you don't have to do it. But understand, if the place where you're going to deliver, they screen it and they have a policy to give you antibiotic, the doctor might tell you that suppose if you come in labor or you start leaking and you're not laboring, we might give you the antibiotic anyway. Like, some people think that it's mandatory, but you always have a choice to say no. Like, do your due diligence, do your research, and if you think there are some patients who don't want anything. They want everything natural and nothing bad happens. And some of them, they want everything natural and still all the complications one after the other can happen. Nobody is dying, but then the whole experience becomes unpleasant. So you always have a choice to say no, but understand why we are doing it. And ask your doctor, have the courage to ask your doctor, why is it done? Can you please explain? Some of them can explain to you very clearly because they are so clear in their mind. And some of them might not because of something going on. So you just keep asking. And if your doctor is not helping you out, you can come to me, call me, get on the call, on the weekly call, and bring your questions to me.